So I hope you enjoyed this week talking about health literacy. It's not in our book, but I think it's so important that we understand and talk about health literacy because it's a big part of our ability to impact health. So before talking about health literacy, let's talk about just literacy. In the United States, at least 14% or 32% of US adults read below a basic level. 21% of adults read below a fifth grade level, and that's a level below what is needed to earn a living wage. Astoundingly, 1 in 5 high school graduates cannot read. In Alaska, according to the National Institute for Literacy, 11% of Alaska's adult population functions at the lowest literacy level, level 1. But what is this level 1? At level 1, a person functioning at this level of literacy can usually sign their name, identify a country in a short article, find a piece of information in a sports article, locate their expiration date information on a driver's license, and total a bank deposit entry. But persons functioning at a literacy 1 level cannot usually locate eligibility from a table of employee benefits, find an intersection on a map, find 2 pieces of information in a sports article, enter background information on a Social Security card application, or calculate the total cost from a purchase order. So let's define general literacy. In general, it's being literate. It's having the ability to read and write. To be a functional literate, it is to be able to use the information to do things, achieve your goals, and continually learn. So these are pretty loose definitions of literacy and functional literacy. And given that it doesn't have any parameters, it's hard to say whether you're illiterate or not, or pre-literate or not. The benchmarks actually change over time. It used to be that one was considered to be literate if they could write their name. Now this would be an indication of illiteracy, or as I prefer to say, pre-literacy. So does a person's grade always indicate their literacy level? So although education is typically correlated with reading level, my son is in 6th grade and he reads at a 6th or 7th grade reading level, where he should be. But there still exists a disparity between education level and reading level. On average, US adults who have completed 13 years of education are typically reading at an 8th grade reading level. So grade does not always indicate literacy. And as I said before, at least 1 in 5 people are not able to read even though they've graduated from high school. Poverty and literacy are demonstrated to be interrelated. For example, it's been estimated that 2/3 of students who cannot read proficiently by 4th grade will end up on welfare or even in jail. According to the National Center for Education Statistics, 43% of adults with the lowest literacy levels live in poverty. 17% receive food stamps, and 70% have no job or a part-time job. Beyond general literacy, being able to read and write, there are situations where situational literacy is important. For example, when I deal with my car, I wish I had more car maintenance literacy. When I'm dealing with my computer, which is always malfunctioning, I wish I had some type of computer literacy. My husband's a great cook, but I'm very happy to not have any cooking literacy. So there's situations where we might be pre-literate or illiterate compared to others, regardless of our ability to read and write. This week, I want to focus primarily on health literacy. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. It's a set of skills needed to navigate the healthcare system. It's related to regular literacy, Reading, writing, verbal communication, and numeracy are very important in health literacy, and it's related to education, age, and ethnicity. So poor health literacy is a stronger predictor of a person's health than his or her age, socioeconomic status, education, or ethnicity. And this is a statement from the American Medical Association in 1999. In fact, it's been described as being one of the biggest risk factors for health at all. It's even talked about as being a vital sign of health, being able to understand, read, numerate, and use health information. So according to the Institute of Medicine, who set out a report called Health Literacy, A Prescription to End Confusion, 48% of U.S. adults are incapable of obtaining, processing, or understanding basic information and services needed to make appropriate health decisions. So they're not having high health literacy. A review article that looked at 85 studies that included over 31,000 U.S. adults showed that 26%, a quarter of them, had low health literacy. 20% had marginal health literacy, and so 46% are showing inadequate health literacy. Nearly 50% of adults can't adequately use our healthcare system. So think about the AMA video I asked you to watch about health literacy, and if you haven't done that, please pause here and watch it. It's only like 5 minutes, but it's amazing. And this woman was featured in it, Miss Cordell. She's identified as having a 5th grade level, even though she graduated from high school. Okay, and so think about what she had to say. She went to the doctor with a health issue. The doctor said that they could fix it. When she went in for her surgery procedure at the hospital, she was given multiple sheets. She was presented with all these forms. She said that she knew she didn't understand them. She couldn't read them fast enough, and she was concerned. But she said to her they were just lines and circles. But as she quoted, she said, "I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then, a couple weeks later, in the follow-up office visit, the nurse said, 'How are you feeling since your hysterectomy?' Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't even know it?" That is a complication of low health literacy. So we know that poverty and literacy are related. Poverty, literacy, and poor health outcomes are also interrelated. There are many consequences of low health literacy. People with low health literacy are less likely to have adequate insurance, to report excellent or very good or good health, to have health-related knowledge, and to use preventative health services such as screenings, physician visits, and immunizations. People with low health literacy are more likely to have negative health outcomes, up to 3 times, possibly because they're not using these preventative health services. And they're more likely to use the ER and be hospitalized because they often wait until their health issue is an emergency. In terms of economics, $232 billion a year in healthcare costs are linked with low adult health literacy skills. Health literacy and health outcomes continued are that people with low health literacy are more likely to be diagnosed at late-stage cancer. This might have to do with the fact that they're not using screenings because they're not sure when and how to do this. They're more likely to be non-adherent to medical regimens and to have medication errors and complications. In contrast, people with high health literacy are more likely to have better outcomes in surgery and to take their medications as prescribed. That has to do with having high health literacy and being able to understand and use the information for their health. Health outcomes associated with high health literacy include many different types of people and different types of issues. So, for example, Among people with HIV, they're more likely to have an undetectable viral load and to have more beliefs that treatment will help them. And we learned about that in the health belief model and the theory of planned behavior. Among asthmatic patients, they're more likely to use their inhalers as recommended or directed. And among diabetics, they're more likely to have better blood sugar measurements. So I'm going to take a pause here and we'll come back for one more small lecture to talk about health literacy and how it works with our healthcare, with our own health, and how it can be measured.